So we're going to start. Welcome to this workshop. This is the Aerolase workshop. So this is good because we're going to try to show you in the next hour one of the most versatile devices that exists on the market. And I think there'll be a slide later, but I'll say it now. This is actually I have 60 lasers in my office. This is by far my most profitable device. We turn it on at 8 o'clock in the morning, and it goes until 5 o'clock every afternoon. We treat between 8 and 10 patients a day with it. And I mainly use it for acne and some for vessels and some pigment and a little bit of hair, but I mainly use it for acne. But other people we're going to see do different things. So we have an incredibly distinguished panel today. Dr. Jason Emer is a dermatologic surgeon par excellence from Beverly Hills. He has been a revolutionary leader in our field, which is really nice because I'm getting too old to do all this by myself now. And it's so nice to be watching the next generation take over. And Jason is by far one of the leading experts in what we do in dermatologic surgery and cosmetic surgery. And then we have Dr. Ed Zimmerman, who sometimes is known as my brother. And he's a cosmetic surgeon here in Las Vegas and also one of the biggest talents in the use of devices and all things cosmetic. So you're in for a treat because we have some really, really neat people. I'm just a plain old dermatologist from Nashville, Tennessee. I've been at this for about 30 years and run a very large practice and research center and have been involved in the cosmetic world since I started. And I always tell people, dermatologists learn from big books that are like this thick and we have to memorize them. And my first day of residency, I did a hair transplant. And the second day of residency, I did liposuction. I thought dermatology was the coolest specialty in the world. And then they handed me a book. And I actually had to learn everything about dermatology. So it's been a wonderful ride. And we're all very blessed to do what we do and hope that you'll learn something from this. So we're going to go over the technology part of the device that we're going to talk about. We'll talk about two different devices, a couple different things, but the main thing is this short pulse 650 microsecond 1064 ND-YAG laser, which has changed a lot of our practices, and that's the one we're going to spend a lot of time with. And I will talk about that. We'll treat some acne with that. Then Jason will come up and he will also talk about how he does stuff with the Neo and combining it and treating rejuvenation effects with it and show some of that. And then Ed will come in and we'll talk about some vascular lesions and pigmented lesions with the Neo as well. And then we'll show you what that's all about and how simple that is. So we'll start with this. So the coolest part of this is if you see the device, which you can't see here, but you can see it up on the screen, is that it's portable. So if you're in an area that you don't have a lot of space, or you have multiple offices, this becomes like a little suitcase that you would put in the overhead bin in an airplane. It's that compact of a device. So they were very smart in how they were able to put all the working components of it here and in the handpiece, and so it's just different than any other lasers that we have. So it's not bulky. We don't have fiber optic cables. It's easy to move around, and there's no warm-up time. This thing you turn on, it's ready to go. And again, the laser emitter is in this handpiece. When you talk about 1064, we start talking about an enormous amount of power, 225 joules per centimeter squared. So if you think of things like pulse dye lasers and things like that, we're talking 7 or 5 or 6.5. So when we're talking this kind of power, that's a lot of power to deliver, and you got to make sure it's delivered safely and easily and comfortably with your patients. The handpiece does not contact skin, so there's nothing you have to worry about there. And what's really cool is there's no skin cooling or numbing required, and they don't count how many treatments you do, and nobody cares how many treatments you do. Once it's yours, it's yours. So it's important to realize it's different than what the traditional long pulse 1064. Long pulse 1064 is an incredibly useful device. I mean, we all have them and I use them a lot. We use them mainly for leg veins and for dark skin hair removal. And that's what its benefits are, and that's sort of where it stops. There's not many other things you can do with it. We're going to show you later that you can use a short pulse 1064, 650 microsecond, to treat a lot of different things. So there's like 50 or 60 FDA indications, approvals for treatments with this. When you get into the long pulse, when you start getting lots of power, you can have some pain, and as I'm going to show you and we're going to demonstrate, this is totally painless. And that's really important when you start thinking about acne, because when you're treating young people, teenagers or young adults with acne or anything, if you hurt them, they're not coming back. And again, when we do this, this is a series of treatments, so you have to have something that's not going to hurt. And again, as I said, I turn my machine on in the morning and I don't shut it off until the evening. Again, the pulse durations are extended pulse durations that we use, very high fluences, but in a very short pulse duration, and allows the energy to pass through the epidermis much faster. And again, we don't see overheating of the skin and we don't see burns with this. And I can honestly say, and I've had my machine probably the longest of anybody in this room, I've never seen a burn. And that's really bad to say, because I always say if you have something long enough, you're going to see everything. But I've not seen any with this, so that's helpful too. Why is efficacy high at this pulse duration? The targeted tissue has less time to lose heat, therefore the targeted tissue reaches that higher temperature. And the treatment is gentle, that multiple passes or pulse stacking are well tolerated. So if you need to do multiple passes, it's fine to do. It's safe, gentle with this. Again, it doesn't cause anything that is going to cause any discomfort. So one of the things that's very valuable with this machine, and I think it's very important, we are able to treat any skin type with this machine. Okay, that's really important, because if you know anything about the world, it's like 50% or so already is skin of color, and it's going to be more shortly. So we have to be able to do things on types 4, 5, and 6 skin. This can do it. So there's no skin cooling, lack of pain, we don't have to numb, and again, cross that out, okay? All right, acne. So acne is the most common dermatologic condition we see. It's estimated that 94 to 96% of all adult females will have acne at some point in their lives, and that's a lot of people. We do have incredible medicines for acne. And unfortunately, some of them are antibiotics, and there's a huge antibiotic resistance thing going on. So we can't use as much antibiotics as we used to, or you shouldn't use antibiotics. And then if you get into certain medicines, we can have some pretty bad side effects, especially if you get pregnant on isotretinoin. That's not a good thing to happen. And the reality is, if you look at the approvals for some of these medicines, they're approved for once a day use. I always tell my patients use them twice a day, because if I get them to use it once, I'm happy. Because if you tell patients to use something once a day, they're going to skip every third day or fourth day. Again, antibiotic resistance. And if you look at the studies, most acne medicines are 12 weeks in duration studies, because it takes that long. So this is actually something I wrote in 2006. So I, again, have been using devices for a long time. Again, we have fallen short on some expectations on how we can treat acne. We've tried a variety of different lasers over the years, and some do okay, and some do less than okay. This is a device that works by destroying P. acnes, which is the bacteria that cause it. There is a photothermal effect and a selective photothermolysis of blood vessels in the region. So again, this is a study that was presented a couple years ago looking at this for acne. It was 100 patients, and again, people cleared really nicely, no complications were done by that. So I'll show you just a series of patients. Some of these are not mine, but some of them will be mine. Very bad acne. You see just 3 treatments to get to this point in time. Again, total clearance here, this is 5 treatments. And there's no set rule on how often you treat these patients. So I actually treat these patients every other week if I can. I know people also will treat every month, but I like every other week. And again, these are skin of color, and again, it works exceptionally well. So I always show this and I always talk about this patient. This is my poster child for this therapy. So she actually, I took care of almost her entire teenage, can we go back one? Where'd it go? Almost her entire teenage life. She had 4 courses of Accutane or isotretinoin. She failed all 4. She went to college in 3 months or so before this left picture was taken. She was totally clear. And then she came back to me and said, Dr. Gold, this is what I'm at school. I can't have this. So we actually treated her 5 times, and this is a year later. And she's been this way for about 6 years now. So either I cured her acne with the laser, or it was time for her acne to go away. Because again, dermatologists, we don't cure a lot of things. We make a lot of things better. And acne is not something I always think I can cure. So I'll take credit that the laser cured her this time. But we'll never know. So again, when you look at the neo versus long pulse, this is what we can treat. This is just a partial list, okay? So keep this in mind here as we get into this. Again, it works well for hair in dark-skinned people as well as in anybody. And again, so this is a lighter skin. This is it's hair reduction. It's not permanent hair removal. But you see here, this is just one treatment. This works really well here. Again, hair removal in the axilla. And then pseudofolliculitis here. Again, you can get some very nice results. So here's one of my patients. This is a year and a half after we treated his, whether this is acne keloidalis or pseudofolliculitis, whatever it was, it went away and stayed away for a long time. These are some facial veins that we treated. A little angioma on the lip, one treatment gone. Rosacea, there are those that out there that say if you have patients with rosacea, that a laser is the #1 treatment of choice. This stuff is going all by itself because I'm not pushing a button. This is poikiloderma, which is a dermatologic condition which has redness, brown spot. Can we go back one? I'm not touching the thing. So redness and some brown associated with it, and you can see here it went away pretty quickly. Jason will talk about tightening, but it works well for tightening as well. You can use this as a way to shut vessels down in patients that have really bad palmar-plantar psoriasis or plaque psoriasis that are resistant to treatment. If you like nail fungus devices, you can use it for nail fungus as well. So this is one of my favorite pictures. We were just at a meeting, 2 weeks ago in Aspen, and we spent 2 hours, 3 hours just treating post-filler patients from the go back one, please, from people that got bruised from having fillers injected. So this is 2 days after one treatment. The reality is in my office now, I actually treat them once, let them sit for 30 minutes. I treat them a second time, and about 95% of that bruising will go away by the time they leave my office. So we are very popular at meetings. We just take the device, plug it in a corner and tell people to come find us. So again, it's the most frequently used laser. It's also my biggest profit center. All right, so let's treat our acne patient. And so can we get the screen up there? You're gonna come up and treat? Yeah. Jason's gonna come up and treat?
Yeah, I'm gonna need that. He's gonna need a goggle.
We're good.
Can you guys hear? Can you
You're
hear
on?
me? Can you hear me?
On.
Hear me? Okay.
Grant, right? So we have Grant here. And Grant has, if you look on this, can we get the screen up here? So Grant is very, he just grew this last night for us.
Yes.
Grant has two, but this is very common. So again, think about it. Grant comes into your office, okay? This I get every day of my life. Dr. Gold, I got the worst pimples of my life, okay? Or I didn't have pimples, and look what I woke up with today. I've got these pimples right here. There's actually 2 or 3 right there. All right? He doesn't need, doxycycline and other things. You can take a steroid injection and hurt him a little bit, or we can do something that's painless and it'll go away within a day or so. So I like that concept a lot.
Good job. Okay, so there's different hand pieces or tips that can be used on this device. Specifically here, we're using a 6mm focused lens. This allows us to globally treat the area. You can see that here. Let me show this really closely.
You got it.
There's the tip. And what's great about this is then you can globally treat the area, reducing the oil and killing some of the acne that's there, some of the propionibacterium acnes that's there. Let me just make sure we're on. Okay, good. So we're going to just treat locally this area, and you know, pretty good distance away. We just focally treat non-stacking pulses in sort of a rectangular square area. Even though his acne is in the center, we're going to try and go sort of all around the area to globally reduce oil and bacteria in the area. And then we'll use a targeted focal lens of 2 millimeters directly over the acne itself to kill the pus and any of the oil that's inside the comedone or the cyst. How does it feel, by the way?
Just a little warm.
So just to mind you, for the people out there, try not to go over his eyebrow, because if you do, it's gonna be gone. Okay, that's one thing. Don't worry, yours is still there.
We can do that. You want Grant? We can give you that one eyebrow look.
So we're globally
Vegas,
going
you
over
know?
the area, 3 to 4 passes. We're gonna do one more, and mind you, remember, he's dark skin type. So we're at a pretty decent strength here, which would be like we were talking about before in a more ablative or not a microsecond delivered pulse laser would cause some irritation or damage to his epidermis. Here, even with sort of stacked pulses, he's fine. And we're gonna finish the last pass. You don't feel much, right?
Nope.
Excellent. So often my patients will say you're not doing anything, so I have to show them the video because they don't believe that we did any treatment. So now what we'll do is we'll change the lens. I'm going to show really quickly how we took that off here, okay? And we're now placing on our focus 2 millimeter lens, which is great for the local small cysts and pustules. Now, luckily, he only has, what, 2 over there, so not too bad. Okay, so now we can focus the beam on the areas that he's coming in for, and usually in this, let me get this so you can see it a little bit better.
Good.
We can go directly on the spot.
Do you see how it's directly on the pimple right there?
Okay, right over it, and we just hit it once, take a look, see the color. It actually responded very well there. I'll do one more. Perfect. You see the little bit of the darkening that's there? It means we got the cyst inside. Same thing here. You see how that darkened a little bit? Do one more pulse. Perfect. Great.
Okay. So that's as simple as acne treatment is. Takes about 10 or 15 minutes total to do a patient. No pain, no discomfort. Whether you use it with medicines, without medicines, it's all fine. In my real world, in my study world, I'll do it without medicines. In my real world, I use it with medicines. So that's good. All right, we'll go back to the slides for a minute. Thank you, Dr. Jason.
You're welcome.
All right, so I want to mention another device, and you say this works. Okay, this is the LightPod Era, which is a skin resurfacing. So this is an Erbium YAG laser, 2940. It's another portable laser system, but this technology eliminates collateral thermal damage. So the way they've designed it is that we use this more like micro laser peels or things like that to remove top layers of skin. Treatment pain and healing time are minimized. Partial face treatments can be done, so it's hard with some of the big boxes to do partial faces. So here, again, we're looking at just gentle resurfacing around the eyes, and you see the improvement here, just 9 days after one treatment. Sorry about that. So this is another patient. This is 2 weeks after one treatment. And you see here just the whole area treated and the refreshed look, the pigment's gone, the skin quality is better, everything just looks better. Again, look here. This is Erbium resurfacing, and again, I use the word micro laser peel because that's easier for my patients to understand what I'm doing. Here, again, look at the difference here. So, you've taken years off her life. This is just 2 treatments with some just resurfacing. And again, this mimics anything else I can do with any of the more, expensive different devices that exist. Here's another patient again here, and the improvement just after 5 days, just doing resurfacing. Oops, go back one. And again, here, just this, there's a surgical scar here. And again, you can see there is still a little scar here after 2 treatments, but very little noticeable scar. We go from here to here. So again, this is a burn, and you just sort of can revise that burn by doing some Erbium laser resurfacing. All right, so I'm now going to turn it over to Jason, who's going to come up and talk about what sort of the rejuvenation effects with the Neo thing. So it's that one.
Perfect.
And that one.
Perfect.
All right.
It's not too much to actually that we're going to demo or discuss in the PowerPoint because we're going to show you in the demo. But in my practice, we have a lot of patients that have acne scarring. So we're treating the redness and the scars, but also we're trying to use this in combination with other therapies to get more improvements. So people have gone to my lectures before, it's all about combinations. This treatment can be used with any device you have, any laser, any microneedle. It's pretty much like an added benefit. What's great about it is the deep heating gives you some tissue tightening, and you saw that in one of the pictures. So a lot of my patients say, especially around the mouth, under eyes, and on their jawline, when we do this with lasers, they notice a lot of tightening. So we'll combine that frequently. The other is pigmentation, decreasing melasma, making the skin look more rejuvenated, the redness that you saw in the poikiloderma, but also color, which we'll talk about next. So in general, we can use this device everywhere for global collagenesis. You can even use it on the lips to get improvement in sun damage as well as plumping that area because it's rejuvenating the lost collagen and volume that's there. Water is the primary chromophore, so it's basically being attracted by anything else in the skin, and we get collagen stimulation long term with the reduction in oil, which is what we were showing before. We were trying to do in a focused beam, but in a global area, we can treat it to get toning, to get firming. Areas like things like rosacea because of the redness, melasma. How melasma is working, the effects of the heating is deep, avoiding the epidermis, which we don't want to irritate because we can get post-inflammatory hyperpigmentation or rebound. But by deeply heating, it tells the body to get rid of that deeper melasma, and it stimulates a local either extrusion or the body sort of lymphocytes pulling it away, getting rid of active acne. And then because hemoglobin and melanin are chromophores, for these areas of indication, you get improvement. If your go-to is typically another treatment for rejuvenation, you can add this in to get more of an outcome. So we're just going to show you a picture here of a patient of mine with chest wrinkles and neck, and you can see the improvement there in tightening as well as texture, color, and tone. And then there's other examples here of just some global rejuvenation. There's acne, there's redness, there's oiliness, there's larger pores. We're using this treatment to get in a better outcome. Same thing here, even some lifting and some tightening. You can notice that complexion is much more blended. It just looks better. Overall, we had presented this patient on the doctor's show that we did with the laser in combination with fillers. So patients always say I have darkness under my eyes, but they also have hollows. It's the blood vessels, it's the pigmentation, it's also the volume. So we did both there. So we can show some improvement now, and we'll show you what we would do in the office in a live demo. Hi. Okay, so we're going to give you some goggles. You can take those and place those on. Okay, so what are you looking for? Why are you doing this treatment?
I have some redness and also some peeling.
Got it.
From sunburn.
From sun, okay. So she has some damage, she has some redness and stuff, it's perfect. You can see if you look at her skin, there's actually a hint of some melasma up in the top upper portion, so complexion's not fully even. Some people, I call this sort of waxy acne, where you see these clear sort of yellowish papules on the forehead, cheeks, and chin, which is probably hormonal and due to an increased amount of oil. And so what you can do is similar to what I showed you guys before in the previous patient with acne, we can globally treat the area. Now, we can get energy is pretty high, even with her darker skin type. We usually start at a standard sort of somewhere between 4 and 6 treatment level, which is somewhere between 18 and 28 joules of energy. And we're going to use the 6 millimeter and sort of just globally treat. And so before, like I was describing to you, we'll follow the pattern. And again, we're going to avoid her hairline, because we don't want to leave her with a different hairline. How does it feel?
Slightly warm.
So it feels nice. Yeah, a lot of patients say that, I'm sure. And the acne patients that come in to see you for this, they like it because it feels like a spa treatment.
It does.
And then you could do a peel, you can do skincare, you could do light therapies afterwards, which is what we typically would do. So I was going to throw you under the light. after this, because then you would decrease any inflammation. And so you see how I'm just going over the area multiple passes, and you don't feel any excessive heat, do you?
No, not at all.
Great. And so each spot, we just follow along, and you can see if she's feeling a light amount of heat, that's perfect energy. We don't want to overdo it. What we could do, if you guys want, since I would like to give her kind of a full treatment, would be to maybe ask some questions. Are there any, Michael, that you want to ask?
So does anybody right now have any questions?
I won't be able to hear unless
That's
you repeat
fine.
it.
I got them for you.
Sorry. Or
Anybody
you
have
can
any
answer.
questions? Yeah.
I'm going to start now on your face.
So the question is, would you have to stop any hydroquinone in somebody that has melasma or is on hydroquinone? I don't see why you would. So the big thing in our world was always, should you stop retinoids before it? And if you're doing a resurfacing procedure, yes, but not a toning procedure. So I don't see any need. And Jason, would you agree to that?
Yeah, we don't really stop any of the topical products before. What was the question, right? Sorry for me to hear with the vacuum.
No stopping anything.
Yeah,
topical.
we don't really, because there's really no irritation. It's deep heating.
And she's not going to be red.
No,
I mean, she may be pink for an hour or two, and that's about it.
Yeah, and if you were doing a combination of a laser or a peel, maybe it's based upon what you were going to do there. But for this treatment alone, I think you don't need to do that.
Okay, another question.
How does it feel?
So that's a great question.
Good.
So the question is, what about somebody that's got acne who's on oral doxycycline? Well, again, this is targeting P. acnes, and the spectrum of light for where this is targeting is at about 420 nanometers, and doxycycline is not near that thing. So I have patients on antibiotics all the time, and I don't stop them. I'm not concerned. I don't care. If they're on antibiotics and you want to keep them on it, go ahead and keep them on it. Another question. Any other questions? In the back. You got to talk loud. Are we putting anybody on hydroquinone? Yeah, so that was the same question. So if somebody's on hydroquinone or anything, we don't stop them. All right, different question. I'm going to come back here. Okay, what's the question?
Is it getting warmer?
Oh, so all right. So that's the gazillion-dollar question. So if somebody's on isotretinoin, okay?
There you go. Good.
The literature says for every kind of procedure, you need to wait a minimum of 6 months, up to a year. There are going to be new guidelines of care that are coming out that are going to dispute that and tell people that it's okay to do these kind of procedures on isotretinoin. If the patient ever had a problem with that, you're not going to win in court. All right, so having said that, I've treated hundreds of patients on isotretinoin for hair removal, for toning like this. I'm very comfortable with that. I make them sign their life away.
Turn your head all the way.
But the reality is, if you don't have the right consent forms and everything, and the patient gets a problem, which is scarring, which will never happen,
Do you do hair removal
you
on your
are going to have a
sideburn?
difficult time in a lawsuit.
No? Do you do
Until
any hair
those
removal
papers
on
are
your
out.
sideburn?
And they're coming. They should be out in the next, by the
just
next
wondering,
2 or
because
3 months.
I could see
I
that.
actually reviewed about 3 of them
actually did.
for a couple of the different journals. So there's an effort, there's a really concerted
Hold on, will you
effort
give
to
it
get
1
these
second
papers
break?
on the market out to us so that we can use them as our basis now.
Okay.
So if you don't know the isotretinoin story, I'll give you the short version. When I was a resident in 1980 something, we treated a patient at Northwestern that had with dermabrasion, not microdermabrasion, wire brush dermabrasion, and the patient scarred, and the patient hadn't been off Accutane or isotretinoin. It was like 2 or 3 months off isotretinoin. And therefore, my chairman and the 2 people that wrote the article with him came to the conclusion that we should wait 6 months. And that became the standard of care in 1980 something. And then a couple years later, it got pushed that they did more reviews and found that we really should wait a year. But that's microdermabrasion. It's an uncontrolled,
Any pain?
removal of the skin. This isn't going to do anything. Laser hair removal is not going to do anything. So the reality is it's safe, but the papers have never been published to say that it's safe. So take 100 patients that are on isotretinoin and do laser hair removal on them. That's a tough study to do. So we had to have lots of case reports, and then you put the case reports together till you get a significant number. And those are now done. So you will be able to do that. I just always caution somebody, so let's say you had a patient and they had a problem and you get sued. Okay, I could line up 100 dermatologists that'll tell the court or the jury that it's okay to do. And all they have to do on the other side is show the 2 papers that were written in the 80s and you lose. Okay, it's that simple, because they have a scar and you didn't do what the paper said, which are still the standard of care.
Do your chin.
Again, I do that. So I treat patients, that are just off isotretinoin. I've treated patients on isotretinoin with hair removal. So it's okay. All right, any other questions? I'm sorry? This is the Neo. This is all the short pulse Neo. Any discomfort, any pain?
No, she said she was getting a little warm after multiple passes, so that's where kind of we have our clinical endpoint there. But otherwise, she's doing great.
All right, so a choice between having a little bit of warmth from the laser or going out to the pool here at the Wynn, which is warmer?
Yeah, the weather here in Vegas.
It's not as hot as outside. Another question.
Sorry.
What is the total cost per treatment? So I think it varies.
So now what we're going to do,
I'm in Nashville, Tennessee. He's in Beverly Hills. I'll promise you he's more expensive than I am.
Light over.
Okay?
No, it's okay.
So when I treat acne, I charge between $150 and $200 a treatment. I do it every other week. I do 10 a day, 4.5 days a week. So you can do your own math, okay? I make enough money that I'm very comfortable. When I do this kind of treatment, we charge about $400 or $500 a session. How much you charge in Beverly Hills?
The same amount actually.
Yay.
And we add a little light, which is what I'm doing right now.
So he's adding a light, and again, this is in the exhibit hall, so this is just an unsolicited plug.
No, it's just fun. I think patients love it. It's not because
this is the light stem.
Yeah, and
and it's a red light, and so when I was growing up, we used yellow light. But now you can use red light. It's a wonderful anti-inflammatory, and if the patient does have any kind of redness, this is going to eliminate about 80% of it. So she's under the red light now, and she'll stay there for...
You could do 5 minutes, you could do 10 minutes.
Yeah, 3 to 5, 10 minutes. That's all they need, and it works really well.
And you could do a blue light if you wanted to help out, if it was specifically for acne. Here it's for inflammation and for rejuvenation. We just like, and the patients also feel nice afterwards, so you want to come back for treatment.
All right, so while she's under the red light, we're going to move on.
Oh.
My sidekick here, Dr. Zimmerman, is going to talk. Can we go to the next slide?
Okay, so let's do a little head to toe with this great vascular and pigment removing laser. And we use this every day in the office. There's probably no day except maybe Sunday that it doesn't get used. So we're just going to point a few things out. The 1064 wavelength has a huge affinity for hemoglobin and melanin. It has a nice deep penetration, so it gets down into the papillary dermis where the small blood vessels start. You've got to knock out the heavier flow, the more brisk flow to get the superficial vessels, which are kind of streaming along like a creek, so you can get them to shut down and stay shut down. And it's got a high enough power that the energy is actually absorbed by the hemoglobin in the red blood cell. It heats up enough that it damages the endothelial lining of the vein. So we're really not breaking it down so much as we're cooking it. But it doesn't hurt the surrounding tissue, so you don't get the dents and the pivots and the crusts that you could get otherwise. And compared, looking at an absorption curve here, so as we go up towards the near infrared, and here's our geometric absorption curve here, so we can see that this is the sun way down there, so we stay out of the sun, we don't get cancer-causing rays. 532 nanometers is your KTP, so that's a bright yellow-green. Here's pulse dye up here at 585, 595, and those are more superficial lasers in the scheme of things. They treat more superficial vascular and pigmented lesions. And you have to wear special eye protection, particularly for the KTP, which is super bright. As we get up here into the non-visible near-infrared spectrum, the Nd:YAG at 1064 has a great amount of absorption here. And so that's why it's so useful for treating vascular and pigmented lesions. And you can see compared to KTP or pulse dye or ALEX or diode, it goes way down deep. So here's the superficial part of the skin, or here, the epidermis. And then we're going all the way down past the papillary dermis, well into the reticular dermis, in order to treat the blood vessels that are coming up to the surface and causing us to have an issue. You can treat venous lakes with this and all kinds of fun vascular lesions. Pulse dye is effective, but it has less depth of penetration. It's associated with some discomfort if you crank it up to 10 or 15, and you get some swelling with these lasers because of the prolonged pulse width. It cooks the vessel or the target more, and you can get some purpura. And purpura is tough. I mean, it's one of those things when we're doing fillers and toxins, we say to people, if you bruise them, you lose them. And so we don't want to have somebody who's got little purple footprints all over their face. It's not cool. You can say, well, we know we got the vessel. It's going to go away. But they're still stuck with a bruise that can take a couple of weeks to go away. So KTP is for smaller vessels generally. It's usually a smaller spot size. And it has limited penetration. It's niche there for limited penetration. It's more superficial. The longer pulsed Nd:YAGs, their energy is partly absorbed by water and melanin, but they have more discomfort and occasional scarring because they're cooking for a longer period of time. So they're overcoming the thermal relaxation time of the target. So the Neo has an affinity for hemoglobin, is able to go deep, has plenty of power to cause the damage to the endothelium of the vessel wall. It's capable, as we've said before, of 255 joules per square centimeter, so that's a lot of energy to put into a short pulse. You get rapid heating of the target so it avoids the collateral thermal damage. It doesn't keep the target so hot that everything gets hot around it, so you don't get that issue. You don't get post-inflammatory hyperpigmentation even when dealing with skin of color. And we leverage the power and depth of penetration and hemoglobin affinity, but we avoid the collateral tissue damage by not using these long pulses. And this is one of our patients from years and years ago, and you can see this vascular cascade that she has on her cheek. This could be on her lateral thigh, it could be on the décolleté area, it could be almost anywhere. And usually after a couple, I usually tell people it could take 3 or 4 sessions, I just don't know. Reason being, they leave my office and I can't control what happens after they leave my office. They hop out into 110, 120 degrees, they vasodilate like crazy. And they may be using some medical marijuana or some other vasodilators, as we just legalize that here. So it can be a little challenging. So I tell them, my work is only as good as your homework, and you have to take care to stay out of the sun. Don't cook this. Let the Mother Nature resorb these vessels and come back and see me in 3 or 4 weeks. We'll further treatment. We'll do a little further treatment so we can hit any vessel that's sort of survived our first treatment and keep knocking them down. And then they're going to rest for a year, 2 years, 3 years. They'll come back. They'll have some more vessels. They're not the same ones. We do use polarized light sources to image these things. So we've shown you those before, the little handheld or the ones on the arms. Here are some vessels around the knees. And again, I like to use the polarized light sources particularly because the larger vessels sometimes have to be treated with sclerotherapy or some other modality, a long pulse Nd:YAG, in order to be able to get these small telangiectatic threads to go away for any period of time. If they come back in 6 weeks or 6 months, people aren't as happy, at least in Las Vegas. So you want to keep them clean for a long time. The ones on the trunk are low pressure. They don't tend to they tend to be less resistant. And then here are some angiomas on the trunk or the décolleté here. These are really fun because your visible endpoint, the Nd:YAG is a WYSIWYG laser. What you see is what you get. So your visible endpoint, irregardless of the spot size or the length of the pulse width or the energy behind it, You want to take this until it becomes shrinks up a little bit and becomes a little gray, purplish gray, maybe even just a little more gray-black. And it involutes, it doesn't leave any scars, you don't get any post-inflammatory hyperpigmentation or hypopigmentation, which would be the other risk. So these are fun to treat. Here's a gentleman, his wife sent him in because he developed red dots on his scrotum, and they thought he was going to have an STD or die or something, I don't know. And those cleared up after a couple of treatments there. There's his fruit of the looms, his tighty whities. This is great for treating scars, because every time we do a breast augmentation, an abdominoplasty, a facelift, that scar starts off red, and this allows us to help the scar mature more evenly and lay down more flat. So these red scars, and also stria rubra, not when they're white, it's not a target. But when they have the red in the target, it's hemoglobin, and we can clean that up. So generally, I'll have my staff do that as part of the revisits at the 6-week check when we bring them in for photos and reevaluation. This will just automatically clean up their incision lines and their scars. This one is pretty amazing to me. This is an infantile hemangioma, and I would probably send this to Michael or to University Medical Center or something, and I would think they would have used pulse dye, but look at the amazing result they got. 8 sessions over 12 months, which means putting the kid in a papoose 8 times. So, and you know, the heat energy and there's an immunological effect of these lasers. So you can treat warts and funguses and things like that. And the interesting thing is, if you treat a wart on this toe, the wart that's on the other toe may go away. It's kind of cool. Warts and psoriasis react that way. It's not dependable, so I usually try to treat them all, but you can see there's a little hyperkeratosis left, and that's it. So, you know, we bring them in and we treat them every 2 to 4 weeks that way. And, you know, people can try freezing, wart removers, that just kind of pisses them off. Duct tape, all those things after they fail, take a laser to it. And the lenticos work really, really well. And of course, people have these superficial solar lenticos. And if they're flat, even if they're just a little elevated, but it's particularly if they're flat and you've got a nice difference between the pigment of the lesion and the surrounding tissue, the more discrete they are, the easier they are to treat. And, you know, I would treat this, but, you know, like Jason says, I would treat the entire face. It's a good opportunity to get rid of all the lenticos and freckles and hemangiomas and get everything cleaned up. Here's another one. This might be a little bit of a keratosis. It might be a little elevated, and they tend to just darken up just a little bit. If there's a little bit of sebum in there, you'll actually see a little snap, crackle, pop. They have little lightning bolts and sparks that go through there as you treat them with the laser. And sometimes they'll just heat up enough to peel off, and sometimes they'll just peel off on their own a couple of weeks later. Backs of hands, you know, we talk to people about their faces all the time, but their hands move up to their faces. And as soon as the hand moves up to the face, it gives away the fact that they've had something done on their face. So we really talk to people about nose to toes. If you treat the face, treat the neck. If you treat the neck, treat the décolleté, because there's no line of demarcation that's automatic that the eye won't recognize. And so faces, arms, shoulders, we work our way all the way down. So this laser stays pretty busy. This is a great shot by Cheryl Burgess, and she works with a lot with skin of color. And so she's done some superficial glycolic peels, and then she's evened out the skin pigmentation with laser toning. It's you know, that's a nice way to be able to treat melasma. And I'm going to, I guess, go treat a couple of dots, so we'll give you those.
Okay.
I'll take her off the light.
So we're going to go now treat some vascular lesions.
Okay, you're all done with the light.
You're ta-da. Get you up here.
Perfect. How do you feel?
All right, and while we're getting set up,
Oh, okay, yeah.
as a nice little gift, this is actually one of the cooler bags that you can get at this meeting. It's a cooler, so your beer will stay cool or whatever. In the back as you leave, please everybody grab one. And again, we thank you for staying. We're just about done. So while we're getting set up, anybody have any other questions? Yeah. No, there's no count. Once you own this, this is yours. Okay, they don't care. And again, one of the things about this, I think, I don't know how long I've had mine, but I've had it probably the longest of anybody. So how long have I had mine? 7 years, 6 years? I think, I may have sent it back just to let them check it once. and it's sort of shipped overnight. They ship you a loaner, they check it out, and we get in, and when it's good, I've never had this machine break down, and I do a ton of treatments. Can it be done, so it can be used on red stretch marks?
So we're going to have you.
Not white. I mean, again, so the answer is it can be used on red stretch marks with the the Erbium laser can be used on white stretch marks to try to rebuild some collagen.
So I was going to just do a quick mention before we do the treatment on genital rejuvenation. So I've been doing a lot of research on the use of this device for vasodilation in the penile area, and we're seeing very significant improvements, which we're going to write up soon. But I had done some presentations here in the use of combining this treatment, Aerolase, to that area with PRP and some other therapies, and we're seeing really good outcomes, specifically for patients that have erectile dysfunction or that just want overall better sexual fulfillment. So now you're going to look at this list, and the list is going to have an addition to it of even more treatments that could potentially be used, that it could be used for.
New commercial, Cialis and Light Pod Neo. I see it now.
See? You get it with it, your treatment.
All right, Ed, you're up. Can we get back on the patient?
So we're going to get back on the patient, and Tom's from New York. He spends some time on the water, and he has a little bit of underlying tan. But he's got some great alar blood vessels, so I'm just switching down to the 2 millimeter spot and give our laser a quick second to calibrate. All right, and so I explained to them that this is going to feel a little bit like a warm pin, nothing exciting. And that's going to sound like a vacuum cleaner. And what I'm actually going to do is I'm just going to show him on the back of his hand what that's going to feel like. How was that? Okay. Not horrible? Okay. It's a little more sensitive up on the face. Okay. And I'm going to, can we focus on this vessel here? Are we able to do that? Yeah. So I'm going to have you drop your chin just a little bit. Yep, there's a beautiful vessel right here.
Everybody see that? It's really showing up nice.
Okay, and here we go. 3, 2, 1. 3, 2, 1. And you can see how it's darkened just a little bit. And maybe what we'll have Tom do is afterwards, as you can see, it's reached the visual endpoint very, very quickly. And then he's got a little vessel here on the side. 3, 2, 1. Boom, boom, boom. And you can see it's just sort of...
Move your left hand, Ed. There you go.
So just a little bit of purpura. I'm going to turn you a little more to the side. A little bit of purpura. That will darken up over the next couple of hours, and then it'll start shrinking and going away. And we'll do the same thing. He's got a lentigo on the other side. So I'm going to turn your head towards me. Thank you, sir. And there was a little lentigo right close to his beard.
And we need you to move your left arm again.
So
there you go. Perfect.
Just below the red spot, I'm going to try to be perpendicular, and I'm just going to stack a pulse. And you can see how it's turned gray, and that will just dry up, shrink up, and go away in the shower sometime. And then we can treat his other blood vessels here. So there's a nice one next to the on the ala there. 2. And that's your visual endpoint. Occasionally what I'll do is I'll give it a second or two, and as it darkens, it actually becomes a better target. So I'll go back and I'll treat it again, because I'm using the lowest energy I can, and I'll go at a little bit of a angle this time. And then I'll put some compression on it, because the blood flowing through that vessel might cool it down and allow the endothelium to recover just a little bit. And it'll refill just a little, and that's very easy. That's all the treatment requires.
Okay, we got one more.
We got one
All
more.
right, you're good.
Okay.
Did it
Okay,
hurt at
so
all?
we're-
Any discomfort?
Didn't hurt me a bit.
So 0 discomfort. And again, I think that's
So slip
key.
those off.
We don't have a lot of devices that don't hurt. All right, and
my
that's
pleasure. You did
really
great.
nice
Yeah,
for our patients. All right, we've got one more to show you.
Okay, so Teresa's coming up.
doing him. No.
And Teresa, what are we treating on you
You're
today?
so close. The tip of the
This
device
side.
says Aerolase on it.
What do, okay. So,
Right there.
okay, it looks like maybe there might be a little bruise here we could treat perhaps, or? Okay, because in this light, I'm not seeing the vessel clearly.
Okay.
Do you, there might be something there? I think it's going to be hard to see on,
Right there,
yeah.
this dark one.
See if we can see it on camera.
Yeah, okay.
Okay, so
All
let's
right.
get you some eye
And if
protection.
anybody wants any additional information, they'll be happy to scan a badge or go to their booth or whatever.
Loose or too tight,
And that's
and
good.
just
We'll
close
see
your
Grant.
eyes gently.
Grant's still alive. So his acne's gone and he's still alive.
Okay.
All right, and so
good?
this is a deeper vessel that we're going to treat. Okay, so this is a blue vessel instead of a red one.
Right
So
where you are.
and we're going to have her sit up for that. So can we go back on the patient? And I'm going to outline it a little bit.
Now we got this fancy
You're on,
table
right?
here.
That's good. Can we go back to the patient?
And so I'm going to pull the tissue on stretch just a little. There's a,
It's right here.
okay, and there's one right in front of it as
And
well.
one here. So everybody see those two vessels as
Okay.
best we can?
All right, so here we go. We're going to treat the front one first. And 3, 2, 1. And now it's a little bit darker. I'm going to go up just one notch on my power. And repeat. 3, 2, 1. Atta girl. And now we'll hit this one.
That's
How
pretty
you
good.
doing? Okay. And now we have some little vessels here. And what I do after I treat these individual little vessels, there's one up here, is then sometimes I'll go back and I'll paint with the 6mm spot. This is a 2mm spot, so I use this for all my little discrete lesions. There we go. Now she's getting a lovely response. Okay, and now we're going to turn the other cheek into the camera, see if there's anything major we can see. She's got a couple little more vessels here.
And we have another question.
So while they're answering questions,
Yes. Yeah.
we'll get you some more.
The
treatment.
question was, can we treat larger vessels on chests and things? Yeah, so you saw we treat leg veins with this? Yeah, anywhere. Just as he said, that sometimes there are feeder vessels. So if you don't get the feeder vessels as well, sometimes you can get in trouble. Not in trouble, but they're going to come right back. Yeah. All right, any other questions? Pretty, yeah.
How you doing? Okay.
Yep.
So you'll notice that some of these little vessels will darken up just a little
No.
bit. Temporarily.
No purpura.
And then,
We can't see Edward. Thank you.
good.
All right. So pretty interesting stuff, right? All right. So how about a big round of applause for Dr. Emer and Dr. Zimmerman and our wonderful patients and our wonderful AV team. How about for our AV team? You know, they don't get a lot of, and I promised them I'd finish early. So we are done. We're all here to answer any other questions if you have. We hope this was enjoyable and interesting and informative. So thank you all very much.